Thank you for coming today. We're going to begin in a moment as soon as we get our stream live on Facebook. All right, we're streaming live on Facebook now. Thank you all for joining us for today's briefing. Dr. Duchin is going to go ahead and give his statement. We'll have time for Q&A at the end, and you can use the raise your hand function in Zoom if you have a question to ask at that time for media. And if time permits, we'll also include some questions from the public that come in via Facebook Live. And with that, Dr. Duchin, you have the floor.
Thank you, Gabriel, and thank you everyone for joining us today. As of yesterday, we've had 88,369 confirmed cases, 5,345 hospitalizations, and 1,465 confirmed deaths in King County in the COVID-19 pandemic. This week's forecast shows increasing storm clouds on the horizon. Over the past week, 250 new cases were reported daily, up 26% from last week, and almost 80% from when the latest rise began in February. Our 14-day incidence rate is 148 per 100,000, which is up 37% over the past week. And since early March, incidence rates have been trending up for all age groups except for the 75 and older. And the highest rates are in the 18 to 24-year-olds, followed by 25 to 49-year-olds and the 5 to 17-year age group. The fastest growing increase in the last couple of weeks is among the 18 to 24-year-olds. Rates among adults 65 to 74 remain low, but increased slowly in March, and the lowest rate is currently among adults 75 and older. Overall, COVID-19 incidence remains highest in the cities in South and Southeast King County, including Covington, Enumclaw, Auburn, Kent, Federal Way, Burien, Renton, Tukwila, and SeaTac. For example, over the past 14 days, these areas are experiencing rates of cases that are 2 to 3.5 times higher, rates of hospitalizations that are 3 to 5 times higher, and deaths that are 2 to 4 times higher than North Seattle and Shoreline. Hospitalizations are also continuing to increase. Last week, 82 King County residents were hospitalized with COVID-19, up over 60% from the prior week. And this represents one person hospitalized every 2 hours in King County. Most recently, hospitalizations have been primarily among 40 to 69-year-olds, followed by the 20 to 39-year-old age group, but we're also seeing some increase now among the 70-plus age range. However, it's important to know the number of hospitalized last week is still much lower than what we experienced during most of the fall and winter surge. It's about 1/6 of the peak during that surge. However, our hospitalization rate has more than doubled to 3.6 per 100,000 per week from early March. And this is higher than the peak hospitalization rate during the summer surge, but only 1/3 of the peak level during the recent fall and winter wave. Deaths continue to fall since the peak of the fall and winter surge. On average, over the past week, one King County resident has died of COVID-19 each day last week, compared with 9 deaths per day during the winter peak. And although most of our oldest adults have been vaccinated, not everyone is vaccinated. And when transmission increases in the community, the virus can still find its way to those who are most vulnerable and unprotected. As many of you know who are following the variant surveillance, Washington Department of Health releases a report weekly. We've had over 600 variants of concern identified in King County. The number continues to grow weekly. I want to share a little bit of information about recent trends in exposure settings. As you know, cases are associated with a variety of potential transmission risk settings in the community, as we've seen from the beginning of the pandemic. Over the last few weeks, we've seen significant drops in cases associated with long-term care facilities, which is wonderful. Last month, less than 1% of cases were associated with long-term care facilities compared to 7 to 9% of cases in January. On the other hand, we're seeing increasing trends in other areas. Cases and outbreaks linked to childcare and K-12 school settings have increased a bit from less than 2% of cases in January to 5% over the last 3 weeks. We've also seen 8 outbreaks associated with youth sport leagues in the past 8 weeks. And these teams have been reporting taking precautions during gameplay and practices. However, our teams have found transmission risks and identified opportunities for COVID spread during transportation to sports, travel to tournaments, communal meals, and socializing that happens before and after games. So it's really important for everyone to remember that precautions taken during gameplay are very important, but they also need to be taken any other times athletes and their families are together. We're also seeing an increase in cases and outbreaks linked to non-healthcare workplaces. Over the last 8 weeks, there's been a 16% increase in outbreaks across non-healthcare work sites, and these include manufacturing, retail, delivery, hospitality, and other businesses. Nearly 40% of our cases reported going to work during their exposure period over the last month, while in January, less than 30% of cases reported such exposures. We're also seeing increasing reports of cases at social and community events. Nearly 30% of cases reported attending events such as family visits, group meals, parties, and weddings during their exposure period. That's up 10% from 20% in January. We also have 11% now reporting visiting bars and restaurants, which is up 5% from January, and 10% reporting going to retail establishments, which is also up from 5% in January. We've seen a doubling in cases reported travel during their exposure period from 4 to 6% in January to 8 to 11% over the last 4 weeks. And this includes people returning from spring break travel. And as a reminder, travel at this time poses a substantial risk for COVID-19 transmission. We continue to recommend people avoid unnecessary travel at this time. However, if you do travel and you're not vaccinated recently, please get tested 1 to 3 days before travel. Get tested 3 to 5 days after your trip and stay home and away from others for 7 days upon return. If you don't get tested upon return, please quarantine at home for 10 days. For people who are vaccinated, you've probably heard from the Centers for Disease Control and Prevention today. There's no longer a recommendation to get tested before or after travel or to quarantine, but such people should still monitor symptoms after return and wear a mask and take precautions during travel. And finally, it's important to note that 30% of our cases do not report contact with someone with known or suspected COVID-19. This is silent spread. And again, many cases, up to 50% spread from people before they have symptoms or know they're ill. And it's very important for that reason to be vigilant, take precautions, and continue to understand that this disease is alive and well in our community. Now, I want to talk a little bit about vaccinations, but before I get there, I just want to summarize what's happening with our cases and hospitalizations. Cases and hospitalizations are climbing at a steady pace, and we don't have any indication that this trend will be leveling off soon. And as I said last week, we can't predict how big the surge will be or how long it will last or exactly how much damage it will cause. But we need to be prepared for further increases in cases and hospitalizations over the coming weeks as the effect of recent travel, increasing activities, and the impact of more infectious variant strains continue to promote the spread of COVID-19. Deaths may also increase, though to a lesser extent than previously. Vaccination ultimately will bring this pandemic under control, and the impact of COVID-19 will decrease as more people are protected through vaccination. But at the moment, the virus is spreading more quickly than we can vaccinate. The threat is real and it remains serious. It's important to prevent COVID-19 in all ages, not just the older age groups. So until enough of us are vaccinated, especially given the current increase in cases and hospitalizations, we need to increase steps to prevent the spread of COVID-19 where we work and socialize, in our personal lives, in our homes, businesses, and anywhere people gather. What we need to do is not complicated. Wear a well-made, snug-fitting face mask. Limit activities with unvaccinated people from outside your home. avoid crowded indoor spaces, pay attention to improving ventilation in workplaces, businesses, and homes, including by opening doors and windows, and remember how COVID-19 spreads through the air and often from people who do not appear to be ill or before they develop symptoms. So now I'll transition to an update on vaccination program issues. Nearly 700,000 people in King County have received at least one dose of COVID-19 vaccine. That's almost a 100,000 person increase over last week and represents over 37% of King County residents aged 16 and older. 1 in 5 King County residents 16 and older are now fully vaccinated. Among our older adults, 85% of residents 65 and older have received at least one dose, and that's compared with 74% across the US. And 64% have completed the series, compared with 52% across the US. And I'm happy to report that as of this week, for adults aged 65 and older across all racial and ethnic groups, we've passed the 70% or higher vaccination coverage rate with one or more doses. We will continue to work toward closing the race and ethnicity gap through tailored outreach, community events, and encouraging providers to conduct outreach to establish patients of color. Here's a few ways we're doing that this week. On the first day of our vaccination clinic at our new Auburn location, we had a focused outreach day to reach communities of color who have lower rates of vaccination. We worked with community-based organizations to find vaccine-eligible residents of South King County, and thanks to the work of our partners, we vaccinated nearly 400 people that day, 60% of whom identified as Latinx. At our high-volume vaccination sites, we're taking additional steps to make vaccine more accessible through offering appointments during time blocks instead of specific times to help accommodate people with inflexible work schedules. And we've moved the Auburn site to the Auburn Outlet Mall, which makes it more accessible by public transportation. And we're continuing to hold and facilitate community-based vaccination sites to help serve residents in the environment that they trust. We've had recent events in conjunction with Immaculate Conception Church, the Somali Health Board, the Idris Mosque, and Friends of Little Saigon. And this week, people living homeless in congregate settings became eligible for vaccination, and we're working to match homeless service sites with mobile vaccination teams. We estimate there are approximately 669 sites that may be appropriate for vaccination, and we're reaching these sites in the coming weeks as we get increasing vaccine supply with our partners to administer thousands of vaccinations to people experiencing homelessness, as well as their service provider staff. A lot of this work will be done through mobile teams that will be reaching encampments in unsheltered populations. And finally, let me transition now to close with some information on vaccinations, on vaccine supply. Limited vaccine supply has been our #1 challenge to vaccinating everyone who's eligible and who wants to be vaccinated. For weeks, we've had capacity plans and partnerships in place to serve all eligible adults as soon as we have a sufficient supply of vaccine. And last week, I expressed concern about expanding eligibility if the vaccine supply is not adequate to avoid having newly eligible people who are at lower risk compete with those who are currently eligible by virtue of increased risk or equity considerations. This week, Governor Inslee has assured us the vaccine supply will be adequate to open eligibility to all on April 15th, another 2 weeks. And our vaccine supply did increase last week, which was our largest allocation to date, approximately 90,000 first doses and 147,000 total doses. And for the coming week, we expect the vaccine supply to be very close to where we think it needs to be, if sustained, to meet the demand of the currently eligible people. And we hope things continue to move in the right direction because there are approximately 300,000 people currently eligible in King County who have not yet been vaccinated. We estimate we need just over 100,000 first doses each week between now and April 15th to adequately cover those currently eligible. With whatever vaccine supplies available, however, now and going forward, we continue to focus on addressing barriers to vaccination and facilitating access to vaccine for those community members most impacted by COVID illness and death, and most likely to experience barriers to securing appointments. This includes ensuring language access and availability of vaccine on weekends and evenings, providing transportation to vaccine sites if needed, and sending mobile teams into low-income senior housing and to people who can't leave their homes. And with that, I welcome your questions and our dialogue.
Thanks so much, Dr. Duchin. We will go ahead and begin our Q&A portion. If you have a question from a member of the media, please use the raise your hand function in Zoom, and we will call on you individually. Our first question comes from Steve McCarran. Steve, please go ahead.
Thanks very much, and thanks, Doctor, for taking my question. I wanted to ask you to expand a little bit more on the concerns about the rising number of variants in King County. And was looking at some of the numbers in the state's latest report this week and noticed that the California variant seems to have the highest prevalence in King County right now, which I think is the case for the entire state. But how concerning is that particular variant, and how do these rising numbers each week sort of play into the overall picture of trying to get this under control?
Yep, great question, Steve. So, variants of concern are viruses that have evolved to either spread more easily from person to person, or potentially cause more severe illness, or potentially evade the protection that our vaccines and some of our therapeutic drugs offer. And on the West Coast, this so-called California variant 1429 is very common. And we also have the so-called UK variant B117, which is quite common. Both of these viruses spread more readily than the ancestor strain, the initial viruses that were circulating. And that means that they're more contagious. It's easier to catch them when you're around someone who's infected. It's an airborne disease. People may not know they're in an airspace where someone else who has COVID-19 is breathing out infectious viral particles. And that means, if you're in there for a shorter time, or maybe you would be able to contract the infection if you're farther away than you would have been previously. It's just easier to catch, basically. And that's a problem because that means it spreads more readily. Also with the B117, it's been shown that it causes a more severe illness with a higher fatality rate. And that's not clear about the 1429, though it is clearly more transmissible. So I'm very concerned about these. We all should be. It's one of the reasons we're seeing increasing cases now, despite the fact that we're rolling out vaccination. The virus has gotten smarter, it's more fit, it moves more quickly, and it can cause more severe illness. Over time, it's very hard to predict which of these variants will be successful in becoming the most prevalent. We're tracking in Washington State increasingly well, with more and more viruses being sequenced, but we're still only looking at about 6% of all the COVID-19 cases to determine what, if any, variant they may represent. So over time, we'll have more information about the various prevalences of the different variants, but I can say with certainty that these present a challenge to us. They mean we have to work harder to prevent transmission, and that we need to, as quickly as possible, get as many people who are willing to be vaccinated because our vaccines are highly effective against both of these more prevalent strains.
Thanks very much. Our next question comes from Jessamine McIntyre. Jessamine, please go ahead.
Thank you, Gabriel, and thank you, Dr. Duchin, for your time. Appreciate it very much. When it comes to the variants, this morning we learned about a new Moderna vaccine that's being tested specifically to target the South African strain. Do you think that we're going to see more trials and more vaccines produced specifically to target the variants?
Yes, absolutely. I think over time, we as a nation, public health system, and vaccine manufacturers will be closely following the virus as it evolves and understanding whether that evolution has any implications for immune protection. And if these viruses seem to be evading protection that the vaccines offer, it is expected that vaccine manufacturers will update their vaccines to make them more highly protective as the virus evolves. If that occurs, I mean, the extent to which that occurs really, to which that may occur is really not known, but it is a area of intense scrutiny by both our public health authorities and vaccine manufacturers. So when variants appear that appear to be less well covered by the existing vaccines, there will be intensive work to update vaccines to be effective against whatever strains are circulating.
Thanks very much. The next question comes from chat from Paige Cornwell at the Seattle Times. And Paige wants to know, what should newly eligible residents expect come April 15th? Will there be enough appointments immediately? And is there any concern that people who aren't eligible yet but become eligible then will try and make appointments earlier than that date?
Okay. Well, what people should expect is not to have vaccine for everyone right away. But if the governor is accurate, he's kind of said the check's in the mail on the vaccine, you're going to get what you need. The supplies are increasing. So if supplies do continue to increase, we should have a smaller mismatch between doses available and people who are eligible. And it still will take time to become vaccinated. Like I said, it's not going to be everyone at once, but there will be more opportunities to get vaccinated. So folks will still have to understand that not everyone who wants to be vaccinated immediately will be able to access vaccines. If there are mismatches between vaccine supply and demand, we are asking our community vaccination providers, whenever possible, to attempt to prioritize those people who they know are at higher risk by virtue of underlying medical conditions or the impact of living in a hard-hit community over people who are at lower risk. And healthcare providers and vaccinators can do that assessment quite readily. But ultimately, over time, more doses is a great thing. It means more people will get vaccinated more quickly. And, pending any unanticipated snafus like we saw with the J&J vaccine manufacturing, we're told that vaccine supplies will be increasing in April and beyond. So I think people should expect less difficulty accessing vaccine as time goes on, but it's still going to be a number of months before everyone who is eligible would be able to vaccine should they decide to come forward. The other big unknown is what the demand will be over time. And we hope it will remain very high like it is now, because the more people that are vaccinated, the more protected we will all be as a community, but in our families, our workplaces, our loved ones, and our community members. But at this point, we don't exactly know what demand will be, 2 or 3 months from now. We hope it remains high. We hope the supply is proportional to the demand, but it is impossible to predict accurately.
Thanks, Dr. Duchin. And just the brief follow-up, any particular concerns about people who will become eligible on April 15th trying to make appointments earlier than that?
Well, I don't know. I haven't heard any problems related to that. The appointing systems, as far as I know, most of them aren't taking appointments out past April 15th at this point. If people, maybe I'm not understanding the question. Are you saying people will misrepresent their eligibility and pretend they're eligible when they're not? If that's the case, yes, I would be concerned about that. That would be unfortunate. We certainly would hope that people would adhere to the governor's timetable on when they should seek vaccination. We don't, this is one of the issues that we want to avoid. We want to avoid people who are at lower risk, displacing those who are currently eligible, who are at higher risk by virtue of underlying health conditions or occupation or by virtue of equity considerations. We ask people to please adhere to the structure, the guidelines, the guardrails. We've had concerns all along about people misrepresenting their eligibility, but I can tell you, because if you look at our numbers, how well we compare with the rest of the country for 65 and older, it's largely worked very well in protecting our most vulnerable residents. Now we know not everybody is adhere to the rules, and that's unavoidable and unfortunate. And we hope that that decreases over time and it doesn't increase.
Thanks very much, Dr. Duchin. Our next question comes from Essex Porter. Essex, please go ahead.
Yes, thank you, Dr. Duchin. Would you speak more specifically to the dangers of the Brazilian variant? You've probably seen the headlines from British Columbia where they've had really an explosion of cases, a record number even this week. Is that something that we need to be worried about here, especially since we're practically neighbors?
You bring up a good point that we live in a global environment where the emergence of variants anywhere in the world potentially concerns us here because people travel, they cross borders, and the way to manage the COVID-19 outbreak is to manage it on the global level. So yes, the emergence of new variants will continue to occur around the world. We will probably develop our own variants of concern here in the US that can be exported elsewhere. And for that reason, the vaccination enterprise really does need to be successful globally. So we would be concerned about any variant that shows the ability to transmit more readily or to cause more severe illness, or for which our vaccines or therapeutic drugs are less effective, regardless of where it appears. That said, it's hard to predict, which variants among a mix of viruses that are circulating in a community ultimately will be able to, outcompete the others and be the predominant and successful variant. So yes, I think it's appropriate to worry and be concerned about all of them, but understanding that at this point we don't have a good understanding of what's driving success among all the ones that are out there competing to get into our bodies and make us sick.
Thanks so much. Our next question comes from a member of the community submitted through Facebook Live. And the question is, can the state move up the April 12th review date for the phases, given that schools are opening up for thousands more students on April 5th? If the daily case counts have now been above 200 for 14 days, we've already been above that threshold. Given the beginning surge and schools opening, can't the phase be revisited?
Well, I can't speak for the state. They can answer whether the phases can be revisited. I can't. But I think you may have mistaken two data points. Cases, yes, we're seeing over 200 cases reported a day, but the metric is incidence. It's not cases, it's a rate. So it's a number of cases per 100,000 residents over a 14-day period. And that rate is not at 200, it's at 148 per 100,000 over a 2-week period. So we've not yet reached that incidence threshold that's the trigger for returning to phase 2. The trajectory looks like we will reach it if things don't change in the next week or two, but that's not, with this virus, nothing is 100%. So there's another metric that we track, which is hospitalization rates. And again, we're below the threshold of hospitalization rates that would trigger an automatic return to phase 2. Our rate is 3.6 per 100,000 per week, and the threshold is 5 per 100,000 per week. So we are not above that threshold currently, or the incidence rate threshold, but we are heading up.
Thanks, Dr. Duchin. Anything else you want to say about just the dates of when those phases are reassessed and the ability to take action in between those dates if needed?
The system is set up to allow the state to have time to review and then communicate the results of their findings to the community to prepare for return to phase or to advance to a new phase. Again, any modifications to those rules would have to come from the state.
Great. And our last question from media that we'll have time for today comes from Nick Popham. Nick, please go ahead.
Hey, thanks so much. Dr. Duchin, I was wondering your thoughts on Easter coming up. It's another holiday that we've been concerned about, especially with, we've dealt with Christmas, we've gone through New Year's. Now this seems like the next holiday to be worried about, or at least I'm worried about it. So I was curious your thoughts on this, and now that we're seeing cases and hospitalizations rise again.
Yeah, Nick, I mean, it's just such a terrible thing that this outbreak has done to us, where we have to worry about our holidays instead of celebrate them with joy. I encourage people to have a happy Easter and celebrate it with joy safely. And that means not gathering with people from outside their household who are unvaccinated indoors. Outdoor gatherings would be great. Again, right now we want people to limit activities to the greatest extent possible with unvaccinated people from outside their household, to continue to wear masks and to get good quality masks that fit them well, and to pay very good attention to ventilation. But traveling, gathering, especially large group gathering, indoor gathering at this time with these more contagious variants presents a real risk. And as you know, and I think is a very astute question, you realize that each of our waves was preceded by a holiday season, right? So our summer wave was preceded by, Memorial Day, 4th of July, Labor Day. And then we had Thanksgiving and Christmas and New Year's that was coincident with our very large, most recent fall and winter wave. And now we've had spring break and Easter, and we're in the process of accelerating towards a fourth wave. So again, I encourage people to celebrate with their loved ones, to enjoy the holiday, but to please do it safely and remember that this outbreak is not over.
Thanks so much, and thanks to everyone. If we didn't get to your questions, our apologies. Please go ahead and follow up with the media team here at Public Health. And Dr. Duchin, if you have any closing remarks.
Yeah, once again, thank you to everyone who joined us on Fridays. I did want to close today by congratulating the Seattle Mariners on their opening day come-from-behind win over the Giants last night. A come-from-behind win over COVID-19 is exactly what we all need right now against a virus that's getting ahead of us late in the game. Every unearned run the virus scores is another family member, friend, or coworker sickened or hospitalized. And COVID-19 is not going to collapse in the bottom of the 10th and hand us a victory. We're going to have to work for it a bit longer until more of us are vaccinated. It's time to rally and shut it down once and for all. Thank you for all you're doing to get good information out to the public, to help them make decisions about keeping themselves, their family members, and their loved ones healthy, to keeping our community healthy. And I look forward to getting more and more of us vaccinated each week and putting the worst of this outbreak behind us.
Thanks, Dr. Duchin. Thanks to all of the members of the media and the public for joining us yet again, and we'll see you next week.